Diphtheria. Introduction. Which of the following is true? Choose one of the following options. 1. Diphtheria is contagious. 2. It spreads through sneezing and coughing. 3. All of the above. Correct. Diphtheria is contagious and it can spread through sneezing and coughing. Diphtheria only causes symptoms in the nose and throat. Select true or false. Correct. Diphtheria can affect the nose, throat, skin, and eyes. Symptoms depend on the site of the infection. Could you get diphtheria from using an infected person's toothbrush? Select yes or no. Correct. The bacteria that cause diphtheria live near the throat. Using an infected item could cause infection. Diphtheria can affect the nerves in the body. Select true or false. Correct. The bacteria that cause the infection could move through the body. They can affect the nerves. This could cause problems with swallowing and breathing. Amy has diphtheria and her doctor has prescribed medicines as part of her treatment. Amy takes some antibiotics. She starts to feel better. She still has some pills left to take. Is it okay for her to stop taking them? Select yes or no. Correct. Amy should not stop her medicine. She should follow her doctor's orders. You no longer need the vaccine after age 6. Select true or false. Correct. Vaccine booster shots are needed later in life. The vaccine loses strength over time. A booster shot is needed around age 12 and then every 10 years. Thank you for using Explain.